You know that feeling, right, when things just aren't moving?
Yeah.
That really uncomfortable, backed-up sensation.
Ugh. Yeah.
Well, imagine that for your pet, but potentially much more serious. A real health issue.
Yeah, it's tough.
So today, we're doing a deep dive into megacolon. It's a pretty significant gastrointestinal disorder,
Right.
mainly affecting cats, but sometimes dogs too.
That's right. And basically, megacolon means the large intestine, the colon, gets persistently wider than it should.
Wider, or
Yeah, and that leads to chronic constipation.
yeah.
Sometimes it gets so bad, vets call it obstipation.
Hmm.
And the colon just, well, it loses its ability to move things along effectively. Its motility decreases. Sometimes it's almost absent.
Okay, let's unpack that a bit. So we're not talking about just like a day or two of tummy upset here.
No, this is persistent.
It's an ongoing thing where the colon itself is enlarged and really struggling.
Yeah.
Now, our guide for this deep dive is a veterinary guide to megacolon, so we're getting solid expert-level info here. And our mission today is really to understand the causes, figure out how you can spot the warning signs, and look at the treatments available, just trying to help you be more informed about your pet's health.
Perfect. And the guide, it's quite clear on the definition. It highlights those three things.
Yeah.
The abnormally large bowel, the ongoing problems passing stool, and that lack of effective colonic movement.
Right.
And interestingly, it breaks it down into two main types: acquired megacolon and idiopathic megacolon.
Idiopathic, that always means the cause is a bit mysterious, right?
Pretty much, yeah. The exact trigger isn't known.
Okay, but let's tackle acquired first. What's the sequence of events there? How does that happen?
So for acquired megacolon, the guide describes this process, often starting with long-term fecal impaction, like things just get stuck.
Okay.
And as the feces sit there in the colon, way too much water gets absorbed out of them. So they become really hard, dry masses.
Like little rocks.
Exactly. And this constant stretching, this prolonged distension of the colon, it can cause irreversible damage to the muscles needed to move waste. That leads to what they call colonic inertia.
Colonic inertia.
Yeah, the colon essentially just loses its get up and go. It can't contract properly anymore. Think of it like maybe an overstretched rubber band.
Yeah.
It just doesn't snap back.
Wow, that sounds really uncomfortable and kind of dangerous long term.
So it's a vicious cycle then. Blockage leads to stretching, which weakens the colon's function.
Precisely. The blockage causes the stretching, and the stretching damages the muscle's ability to work. Now, the guide also mentioned something interesting. It says there isn't strong evidence for congenital issues, like Hirschsprung's disease in dogs and cats.
Oh, Hirschsprung's. I've heard of that in human babies, isn't it?
Yes, exactly. In humans, it involves a lack of nerve cells in parts of the colon right from birth, which disrupts movement.
But the guide specifically points out that while it's a known thing in people, it's just not well documented in our small animal companions. So that highlights a difference in how these motility problems might start in different species.
Gotcha. Okay, and then there's the other type. Idiopathic megacolon. Mostly in cats, you said.
Primarily cats, yes.
So what does the guide say about the why for that one, if it's not blockage causing it?
Well, for idiopathic megacolon in cats, the thinking is it's most likely some kind of disturbance in how the smooth muscle in the colon wall actually functions.
So the muscle itself is the problem.
It seems so. Basically, the muscle isn't contracting the way it should, but the specific reason why that muscle isn't working right, that's often unclear. It's less like an injury causing it and more like a malfunction within the muscle's mechanism.
Okay, so acquired has a more sort of understandable, if unpleasant, cause and effect chain. But idiopathic in cats is more of a puzzle involving the muscle itself. Right now, who actually gets this? How common is it? Does the guide give us any clues on that?
It actually says the overall incidence, like how often it occurs, isn't really well established. We don't have firm numbers.
Huh. Oh.
But it is clear that idiopathic megacolon is, mainly a cat thing, whereas acquired megacolon, that can happen in both cats and dogs.
Both species for acquired. Got it.
And interestingly, there's a little hint that Manx cats might have a higher risk for the idiopathic type.
Manx cats. Oh, the ones often without tails or with shorter tails. They sometimes have spinal issues, right?
Exactly. That connection is interesting, maybe suggesting a genetic link in some cases.
Fascinating. What about age? Is this mostly an older pet problem?
For idiopathic megacolon in cats, it tends to be middle-aged to older pets. The average age mentioned is about 4.9 years, but the range is pretty wide, like 1 to 15 years.
Okay.
But for the acquired type, the guide says there's no specific age predisposition. It can happen at any age. And for either type, there's no real difference noted between males and females.
So, if you have a cat, maybe middle-aged or older, especially a Manx, it's worth keeping idiopathic megacolon in the back of your mind. Okay, so how do we actually spot this? What are the signs we should be looking out for?
Right. The history, what you observe at home, that gives really important clues, and it can differ slightly.
Oh, so?
Well, idiopathic megacolon often presents as this chronic recurring problem. The signs might have been there, maybe subtly, for months or even years.
Okay, long term.
Whereas acquired megacolon, that can sometimes come on more suddenly, acutely, although it can also develop gradually too.
So what are the main things, like the big red flags an owner might notice?
The absolute key signs are constipation or even obstipation, that difficulty or a complete inability to pass stool. You might see your pet straining a lot.
Crying really hard.
Yeah, that's called tenesmus. Straining but producing very little or maybe no feces at all. And when they do manage to pass something, it's often super hard and dry. You'll probably also notice they're just not defecating as frequently as usual. And here's a weird one. Sometimes, after they've been straining for a while, you might actually see a small amount of liquidy, kind of mucoid diarrhea.
Wait, diarrhea? When they're constipated, that seems contradictory.
It does, right. But it's called paradoxical diarrhea. It's basically just some liquid stool managing to squeeze past the really hard blockage. So seeing that liquid doesn't mean they aren't severely backed up.
Wow, okay, that's a really crucial thing to know. Don't assume liquid means the problem's resolved. What about other signs? Maybe if it's been going on a while.
Yeah, with chronic impaction, you might start seeing more general signs of them just not feeling well, like maybe occasional vomiting, they might lose their appetite.
Go off their food.
Right, anorexia,
Mm-hmm.
or just seem really sluggish, lethargic, and potentially weight loss over time, too.
Okay, so those are things we might see at home. What about when you take them to the vet? What might the vet find during an exam?
Well, when the vet palpates the abdomen, feels around, they'll likely be able to feel an enlarged colon, packed firm with hard feces. It's usually pretty noticeable.
Okay.
And a digital rectal exam, that's also really critical. It lets the vet feel for any blockages further down, and it absolutely confirms that fecal impaction.
Right.
And depending on how bad it is or how long it's been going on, the pet might also show signs of dehydration. Maybe their skin doesn't snap back quickly, and their coat might look a bit rough or unkempt if they haven't been grooming properly because they feel unwell.
So the vet's hands-on exam really confirms the suspicion. Okay, let's dig deeper into the causes. We talked about idiopathic versus acquired, but what specific things can actually lead to acquired megacolon?
The guide lists quite a few potential causes of what they call mechanical obstruction, things actually blocking the way.
Like what?
Things like pelvic fractures that maybe didn't heal quite right, leaving the pelvic canal too narrow. Or foreign objects, the pet swallowed bones, are a common culprit because they get really hard and stuck.
Oh yeah, I can see that.
Also, an improper diet, maybe not enough fiber or moisture, strictures, which are like narrowings in the colon wall itself. In male pets, prostatic disease can sometimes press on the colon, perineal hernias, tumors in the area, even some rare congenital things like the anal opening not being fully formed.
Wow, quite a list. So avoiding blockages and injuries seems key for preventing the acquired type then.
Absolutely, prevention is definitely better there. The guide also mentioned something called dyschezia leading to acquired megacolon.
Dyschezia, what's that?
It just means difficult or painful defecation. So if it hurts to poop, the animal will try to avoid doing it.
Ah, okay. And what makes it painful?
Several things affecting that anorectal area, like inflamed or infected anal sacs, abscesses there, perianal fistulas, inflammation of the rectum, or anus proctitis.
Right.
Also trauma, pelvic injuries, limb fractures, hip dislocations, even bite wounds or abscesses around the back end can make defecation really painful.
So basically, pain leads to holding it in, which leads to impaction, and then potentially acquired megacolon down the line.
Exactly. That retention is the link. Pain causes them to hold it, and holding it causes the backup.
That makes sense. Are there any metabolic issues or even medications that can contribute?
Yes, definitely. Certain imbalances in the body chemistry can affect muscle function, including the colon muscle. Things like low potassium, hypokalemia, or low calcium, hypocalcemia. Severe dehydration is a big one, too.
Okay.
And the guide lists several drugs as potential culprits. Vincristine, which is a chemo drug.
Yeah.
Barium, used for some x-rays. Antacids, sucralfate, and a class of drugs called anticholinergics.
Huh. Medications too. You wouldn't necessarily think of that first. What about nerve problems? We mentioned the Vanx cat link earlier.
Yeah, neurologic or neuromuscular diseases are definitely a factor. Those congenital spinal issues in Manx cats can mess up the nerve signals controlling the colon,
Right.
but also things like paralysis of the back legs, spinal cord disease, slip discs, dysautonomia, which is a nerve system disorder,
Hmm.
problems with the sacral nerves,
Hmm.
maybe from trauma like a tail pull injury.
Tail pull. Ouch.
Yeah. Or any direct injury to the nerves that actually supply the colon.
It really seems like a huge range of underlying problems can end up causing acquired megacolon. Now, what about risk factors? Are there specific things that just make a pet more likely to develop this?
The guide does highlight a few. Anything that makes it physically hard for the pet to get into the right posture, to defecate like those limb or pelvic fractures or nerve issues, increases the risk.
Makes sense.
Also, anything causing pain back there in the rectoanal area makes them reluctant. Having had a pelvic fracture previously is a known risk factor.
Even if it healed.
Yeah, even if it healed, sometimes it narrows things. And there's a possible mention of low physical activity and obesity, maybe because less active or overweight pets might be prone to other conditions that contribute. And perineal hernias, again, are listed as a risk factor.
So it's not just the colon itself, but the whole surrounding area, the pet's mobility, pain levels, it all plays a part. Okay, so how does a vet actually pin down the diagnosis? Say they suspect megacolon.
Well, the first step is ruling out other things that could cause similar signs.
Yeah.
Differential diagnoses,
Like what?
like other kinds of masses you might feel in the colon.
Hmm.
Maybe lymphoma, carcinoma, or an intussusception where the bowel telescopes on itself.
Hmm.
Usually the vet can tell the difference based on how it feels, the rectal exam, imaging like x-rays or ultrasound, and sometimes a biopsy is needed.
Okay.
They also need to make sure it's not a urinary problem causing straining. So they'll check the bladder, maybe do urinalysis. And if the main sign is straining, tenesmus, they need to rule out colitis, which is inflammation of the colon lining. That might involve feeling the colon, a rectal exam, maybe even looking inside with a scope endoscopy and taking a biopsy.
So it's a careful process of elimination.
Mm.
What about blood tests and stuff? Do they tell you much about the megacolon itself?
Blood work like a CBC and biochemistry panel and a urinalysis, they mostly give supportive information. They can show if the pet is dehydrated. You might see a high PCV, high protein levels. Sometimes there's a stress pattern in the white blood cells. Electrolytes might be off, depending on how long things have been going on.
Yeah.
And you might see kidney values elevated just due to the dehydration that's pre-renal azotemia. The urinalysis mainly checks kidney function, especially if dehydrated, and rules out urinary tract issues.
So the labs give you a picture of the pet's overall health status, points to dehydration maybe, but the real key for diagnosis sounds like imaging.
Absolutely crucial. X-rays, radiographs of the abdomen and pelvis are essential. They let the vet actually see the enlarged feces-filled colon. And really importantly, they can sometimes spot the underlying cause, like that badly healed fracture or maybe a foreign object.
Right.
Ultrasound can also be useful, especially for looking at the colon wall for masses or other blockages. And sometimes, if they really suspect an obstruction they can't see well on X-ray, they might need to do a colonoscopy, use a camera to look inside the colon directly.
And if they were to, say, take a biopsy, look at the colon tissue under a microscope, what does the guide say they'd find?
Interestingly, often not much, especially in the idiopathic cases. The guide notes that histologically, meaning under the microscope, the colon tissue itself frequently looks pretty normal.
Really? It looks okay.
Yeah, the main finding is just the physical widening, the dilation of the colon, usually most severe in the transverse and descending parts, but the whole thing can be affected. But the tissue structure itself might be unremarkable.
Huh. So it's really more about the stretching and the loss of function, not necessarily a disease in the tissue itself in many cases. Okay, let's shift to treatment. Once it's diagnosed, what can actually be done?
Well, the initial approach often means the pet needs to be hospitalized for medical management, especially if the impaction is really bad.
Okay, inpatient care first.
Yeah. Surgery is usually considered for cases that keep coming back or is super severe, or if there's an obstruction that needs fixing surgically. The first step medically is usually rehydration, getting fluids into them, preferably intravenously.
Right, tackle the dehydration.
Then, often under anesthesia, they'll need manual evacuation of all that impacted feces. This involves gently flushing the colon with warm water endems using lubricant and carefully, gently extracting the hard stool. Got to be super careful not to damage the colon lining.
That sounds like it would bring immediate relief. But what about after they go home? What's the long-term plan?
Long-term medical management is often crucial, especially for that idiopathic type in cats. Diet is a really big piece of the puzzle.
What kind of diet?
It varies. Some do well on low-residue diets. Others actually benefit from high-fiber diets. The trick is finding a food they find palatable that they'll actually eat consistently. Sometimes adding fiber supplements helps, like plain pumpkin or Metamucil-type products with fermentable fiber. But the guide does caution against just adding bulk-forming fiber in many cases.
Interesting. What else?
Encouraging activity is good. And for cats with idiopathic megacolon, owner education is vital. You need to understand it's likely chronic, there might be setbacks, and consistent management is key. Sometimes owners even learn to give subcutaneous fluids at home to help prevent recurrence.
Wow, fluids at home.
Yeah, it can really help maintain hydration. But everyone needs to know recurrence is, unfortunately, pretty common with medical management alone.
So it sounds like a real commitment. Diet, exercise, maybe fluids, lots of patience. What about surgery then? When does that become the best option?
Surgery, specifically removing most of the colon, a subtotal colectomy, is usually indicated when medical therapy just isn't cutting it anymore, when the constipation keeps happening despite best efforts.
Good.
Or if there's an underlying blockage like a tumor or stricture, that can't be fixed any other way. The guide specifically says not to give enemas right before this surgery.
Good to know. And what does the surgery involve?
For those refractory idiopathic cases, it's usually that subtotal colectomy, where they remove most of the colon and then reconnect the end of the small intestine, the ileum, or the remaining bit of colon, to the rectum. It might also be needed for obstructive cases if the colon itself is just irreversibly damaged.
That sounds like major surgery. What about medications? Are there drugs that help manage this?
Yes, several can be useful. A drug called cisapride is often used, especially in milder cases, to try and improve the colon's motility, get it moving better.
Okay, a pro-motility drug.
Exactly. The guide gives dosages for dogs and cats, but it specifically notes that another drug, sometimes used for gut issues, metoclopramide, is not effective for colonic motility in cats with megacolon.
Good distinction. Any others?
Stool softeners are very common. Lactulose is frequently used, often alongside cisapride and diet changes. Docusate sodium is another option, and before surgery, they usually recommend broad-spectrum antibiotics to prevent infection.
Makes sense. Anything to avoid?
Yes. Sodium phosphate enemas are a definite no-no risk of dangerous calcium drops. And things like mineral oil or white petrolatum shouldn't be given orally due to the risk of aspiration pneumonia if they inhale it. Oh, and those common over-the-counter hairball laxatives. Generally not effective for actual megacolon.
Right, needs something stronger or different, so it's often a combo of motility drugs and softeners. What about after the surgery? What's the follow-up like?
After a subtotal colectomy, they need really close monitoring for the first 3 to 5 days. Watching for serious complications like the incision site breaking down, that's dehiscence or infection inside the abdomen, peritonitis.
How do they check for that?
If the pet seems to be getting worse, they might need to sample fluid from the abdomen called abdominocentesis, or even do a peritoneal lavage, washing out the abdomen, to check for leaks from the surgery site. 4V fluids are usually continued until the pet is eating and drinking well on its own.
Okay. And can we do anything to prevent megacolon in the first place?
Well, for the acquired type, the guide mentions getting pelvic fractures repaired properly so they don't narrow the canal, and being really careful about preventing pets from eating things they shouldn't, especially bones that can cause blockages.
Right, common sense things for acquired. What are the main complications we worry about with megacolon or its treatment?
The biggest ones are recurrence or persistence of the problem, especially with medical management. Surgical complications can happen too, like the peritonitis, ongoing diarrhea, sometimes fecal incontinence, strictures forming where they reconnected the bowel, or even obstipation coming back. And though less common, a major risk is accidentally perforating the colon during those manual evacuations if it's done too aggressively.
Yikes. Really underscores needing careful, experienced care. So finally, what's the overall outlook? What's the prognosis generally?
Historically, the guide suggests medical management alone often wasn't great long-term. Many cases eventually failed.
Yeah.
But the introduction of cisapride has definitely improved the outlook for medical management in some pets. Still, surgery might end up being necessary for severe or long-standing cases. After the subtotal colectomy surgery, diarrhea is expected initially.
Expected.
Yeah, pretty common. But it usually resolves within about 6 weeks for most cats as the small intestine, the ileum, adapts to absorbing more water. Overall, the surgery is generally well tolerated, especially in cats, and the rate of constipation coming back after surgery is relatively low.
That's good news on the surgical front then, relatively speaking. Okay, so let's recap this deep dive. Megacolon.
Hmm.
Serious issue. Enlarged colon chronic constipation. Comes in two main flavors. Acquired, often from blockages or pain, and idiopathic, mostly in cats, where the muscle itself isn't working right. Recognizing signs early, like straining, infrequent pooping, maybe even that weird paradoxical diarrhea is super important. Causes range from pelvic issues to diet to nerve problems. Treatment involves medical management diet, fluids, meds like cisapride and lactulose, and sometimes major surgery. The subtotal colectomy, which actually has a pretty decent outcome long-term for many cats.
You've got it. It's definitely complex, needs careful veterinary diagnosis and a tailored management plan.
Absolutely. And considering everything we've discussed, the potential for long-term care, maybe even surgery, it really makes you think, doesn't it?
It does, and perhaps leads you, the listener, with a thought. What other subtle changes in your pet's health might you be noticing, and what further questions do you have about being really proactive and catching potential problems early?